I wonder if my friend Christy Smith could explain things from a California level and explain the unemployment insurance process.
All right, very good. Thank you so much, Congressman Sherman. I appreciate the invitation to join you and speak with our shared constituents this evening. I especially appreciate your leadership and the California delegation in making sure that our folks have been taken care of, with these extensions of unemployment insurance opportunities with the PPP program and the work that I know that you'll continue to do to lead us out of this crisis from the federal level. So I thank you so much for that. Dr. Goldman, also lovely to hear from you tonight. But Congressman Sherman has invited me on to give an overview of what's happening with the state unemployment insurance perspective. I'm happy to do that. I'm talking to you tonight from Sacramento. In fact, the Assembly has come back to session this week, so we are back to work and looking to smooth out some of the road bumps that have occurred as we have rolled out unemployment insurance to so many people who need it right now. To date, more than 3.3 million claims have been filed with the Economic Development Department, also known as EDD here in California. Those numbers surged last Tuesday because EDD launched the add-on benefit of the Pandemic Unemployment Assistance Program, which stemmed from the CARES Act, which the Congressman just mentioned. Prior to that, EDD was receiving an average of 2,500 claims per day during the COVID crisis until PUA rolled out. And on that day of the rollout, nearly 250,000 additional claims were filed. So we have heard from a number of you in our office and in my overlapping Valley colleagues' offices, whether it's Luis Rivas or Jesse Gabriel. We're asking your patience, but we're also asking if you're having a hard time with the EDD system or with your PUA application specifically, to please call our offices, and we are happy to walk you through that and then reach out to either tech support or our government affairs folks to help you through the process. So for those of you in the overlapping area with Congressman Sherman, or if my office can be of assistance in any way, our number is 661-286-1565. But there is a difference between the two forms of unemployment that are currently available. One is the standard traditional unemployment insurance, which is available to anyone now experiencing a loss of a job or a cutback in hours due to the COVID crisis. And then the purpose of PUA is to cover those who aren't typically covered by unemployment insurance, such as independent contractors, individuals who are self-employed, business owners, or those W-2 workers who may not have worked enough to qualify under traditional unemployment insurance. And again, if you have questions on that, either call our office or the website is edd.ca.gov for applications for both of those programs, as well as additional information. We do have some questions that have been asked frequently with regards to both of these programs. The 13-week extension of unemployment insurance that has been part of PUA is now being applied in the state's EDD system. So if you have had prior been on unemployment insurance and it has now expired, that 13-week extension will be now covered under PUA, and you want to log into the site to check your status on that. And then depending on when you exhausted your benefits, you'll either be covered by PUA or a new component of unemployment called Pandemic Emergency Unemployment Compensation. So again, check the website edd.ca.gov or give your local state official's office a call, including mine. So we're awaiting a specific timeline for EDD on when they might be able to address some of these cases a little bit more quickly, but as you can imagine, under this volume, the system has crashed a number of times. That's why we're urging you to call us and ask for help if you encounter that issue. On waiting times, sometimes it can be an extensive amount of time to be prepared to be on the phone, although EDD has extended its hours of operation. And so that is now extended from 8 a.m. to 8 p.m., 7 days a week for EDD applications. And our office is here to help. We are available by phone Monday through Friday, 9 to 5. We are also available by email if that's more convenient for you. And again, our telephone number is 661-286-1565. There are a number of other technical issues that you can find information at the EDD website or on our Assemblymember website, as well as the state's COVID-19 information page, which really is kind of a one-stop shop for all things related to the crisis here in the state, everything from volunteering to impacts in your own local counties or jurisdictions, and what are the guidelines as we go forward. But again, what I can't stress enough is if you do need help, the fastest way to file a claim is online. If you do need help and you want to call them directly, that number is 1-800-300-5616. So again, this EDD directly, 1-800-300-5616. And my office for help from one of my staff is 661-286-1565. So that being said, Congressman, I thank you so much for the opportunity to jump on this evening, but we do really want to continue to work with your office. We've appreciated the partnership and looking forward to our constituents who need help reaching out.
I'm looking forward to a continued partnership with you, Christy Smith, and I want to commend your constituent service staff. I've been in Congress for a long time, so I've worked with an awful lot of partners at the state level. Your staff has come through for people again and again, and I say that as one of your constituents as well as the member of Congress. With that, let's open it up to those who have questions. We'll take a few questions. We'll do another survey question. I'll have some questions for Dr. Goldman, and we'll do a number of things in this call, but we'll start. And if you want to ask a question, you dial *3. So Don McDonald, our Chief of Staff, who's our first questioner?
Carolyn from West Hills.
Hello, Carolyn.
Hi. Thank you so much for taking my call. I do have a question. I was really looking forward to hear Dr. Fauci speak and being questioned by a neutral group of our legislators, and he's not being allowed to speak. So I would like to know, why can't he be subpoenaed to speak? I mean, he seems like the kind of person who would definitely answer a subpoena.
Well, as I understand it, he will be testifying before the Senate. He should, but will not testify before the House. The subpoena process would take many months, and on the one hand, I want to hear what he has to say with some of our colleagues asking questions. On the other hand, I don't want his time taken up with fighting subpoenas. Dr. Fauci's in a tough position. If he says what I think he's thinking, he'd be bounced out of the administration. And if that happens, that would make the administration weaker. And so I'd be anxious to hear what he has to say. I know that if he appears before the Senate, there'll be at least a few questioners who will ask the questions I'd like to ask. And at the same time, I know that that he's in a tough position when he and Dr. Biggs are sitting there, and the president talks about just the possibility that maybe you should drink Lysol or bleach in order to kill the virus in your body. I realize that we need Dr. Fauci in that administration as much as possible. The cabinet secretaries and are more, the law is stronger when we enforce a subpoena. His role is twofold. He's part of a White House task force. He's also head of one of the National Institutes of Health. I join you. I'd want to hear him with the House committee. But on the other hand, I feel for the situation he's in. Let's go on to the next question.
Okay, we have Robert from Sherman Oaks.
Hello?
Hello, Robert.
Hello, yeah. Hi, Congressman Sherman. Yeah, my question is about this COVID-19 stay-at-home order. Do you think small groups, more than 2 people, will be okay to go back to their pastor and their church groups and say, like, stay social distancing in the next week or 2 weeks in May, after Cinco de Mayo?
Well, first I want to wish everyone a happy Cinco de Mayo, and also I need to point out, because I covered Fannie Mae and Freddie Mac and renters and homeowners, we expect that the bill we pass this month will provide a lot more help to renters and homeowners that are having trouble making their house payments. Dr. Goldman, perhaps you could address what would be safe, and of course, to some extent, what would be safe depends upon where you are. In New York City and Chelsea, Massachusetts, and you get one answer. Los Angeles County has been hit harder than other parts of California. So, Doctor, what is it safe to do as far as meetings in small groups in California?
So I would say when California is ready to move to the next phase and start relaxing the stay-at-home order, which is not yet, but I think will be soon. I can't say it's right after Cinco de Mayo, no, but I will say that your caller is on the right track. That the first things that will be safe will be small gatherings, and that it'll be quite some time before we're able to get together in large gatherings. If it's the largest gatherings that really were amplifying the epidemic, and like a cruise ship, which is the epitome of that. That's the kind of thing that we won't be able to do for a long time. So yes, probably smaller meetings and get-togethers will be the first things that we'll be able to start doing when we start opening up. I just can't say exactly when that's going to happen, and that's what's going to be different from one state to the next across the country. And it depends on the rates falling, but it also depends on being ready to do the testing and contact tracing.
Okay, let's go on to one more question, and then I want to cover a few of the international aspects.
Sharon, I don't know where you're from, but you have a rental housing question. You're on, Sharon.
Hello,
and what town are you from?
West Hills.
Good to hear from you.
West Hills. Thank you for all the work you're doing. I am confused about this renters policy that you have. I am a landlord, and I was ready to evict the tenant. Unfortunately, this thing happened, and now I am stuck with the person, and they are not paying, and the law says they have 1 year to pay. That means I cannot evict her for a year, or if I evict her, I lose the money that she owes me. I think this whole law is one-sided, and I don't see any protection for landlords. So I would like you to explain to me, what can we do?
We have a complicated governmental system where decisions are made at the city level, the state, and the federal level. And I am not an expert in what LA City has provided, but the rush at the atmosphere at City Hall was protect renters without much focus on on landlords who have expenses and have to pay their mortgages. And I don't know about your particular legal situation with this particular tenant. I don't know if this tenant is unable to pay because of COVID-19 or whether they're simply, there are some tenants who are still getting their paychecks just fine, but for one reason or another are not paying. At the federal level, we have focused not just on tenants, but also on the fact that the rents they pay then allow the landlord to pay their mortgage. And that is why at the federal level, the focus is on those buildings that have been financed through Fannie Mae and Freddie Mac. And with those, and I don't know whether you have a mortgage on your building and whether that's a key thing that you need to pay with the rent that you expected to collect. But if the federal government through Fannie Mae and Freddie Mac was involved in financing your building, and I hate to say you'd have to check both their websites, but if you find the address of your building on either the Freddie or Mae or the Fannie Mae or Freddie Mac website, then you're entitled to a forbearance on paying your mortgage. So while both federal and city government may interrupt the money coming in to your bank account, there's at least some relief for you on the money going out. The plan going forward, and Maxine Waters and I and a number are pushing that instead of saying to tenants, don't pay your rent, or don't pay your rent if you can't afford it, well, what we'll do is have federal aid for tenants to pay their rent, and that may very well be in the bill. We're fighting hard to put it in the bill that gets passed in May. So while at the city level, I think they immediately responded to the thing that was right in front of them, which is there's tenants, they've been laid off, they can't pay their rent, and that's the first thing you see. At the federal level, we saw the two steps forward. Not only can the tenant can't pay, but then the landlord has a mortgage that they have to pay. So I don't know your individual situation, but on a policy basis, that's we're looking at both of the parts. We've got the results of our first survey question. 74% of those responding have said that we should continue past July with the extra unemployment insurance benefits, $600 a week. No is 11%, and undecided is 15%. With that, let's go on to another survey question, and that is, should Congress pass and use federal money to pay for extra hazard pay for healthcare workers and first responders? Should the federal treasury be used to provide additional compensation to healthcare workers and first responders? If you think yes, push no. If you think yes, push 1. And if you think no, then that's 2. And if you're unsure, press 3. Once again, 1 for yes, 2 for no, 3 for unsure. And I want to talk just a little bit about some of the international issues. The first is that I think it was a mistake for us to walk away from the World Health Organization. That doesn't mean the World Health Organization is perfect or shouldn't be reformed. But it's like if the whole city was burning, that's not the time to fire the fire department, or even to fire all the officers in the fire department on the theory that they should have done a better job. There'll be plenty of time after the fire is extinguished to go see whether or not, in this case, the World Health Organization did everything they should. And the World Health Organization is dependent for, they're being criticized by the Trump administration for not independently verifying what the Chinese government was saying about this virus back in December and January. Well, the World Health Organization doesn't have spies. They are dependent upon the host government, in this case China, to tell them what's going on or to give them access, which was denied, to their doctors to go in and see what was going on. The people who do have spies is the United States government. And in fact, we had intelligence that this was hitting the Wuhan province much harder than the Chinese government had said. And so if anyone should have known not to accept the statements of the Chinese government, it was an administration that has by far the most expensive intelligence operation that has ever existed in the history of the world. And in fact, the president, on more than one occasion in December, January, even February, said he trusted the Chinese president, Xi, and that everything was fine and that this disease wasn't going to affect us much. So we should not have pulled out of the World Health Organization. Also, we made a major mistake in not participating in the recent virtual vaccine summit organized by the European Union. The whole world got together to focus on this and to pledge money to make sure that the vaccine was developed and that it was deployed around the world. And it's funny, Bill and Melinda Gates pledged $125 million, and Norway pledged $1 billion, and we didn't even show up. And even if your focus is just on the United States, working with others to develop a vaccine is critical to the United States. And once a vaccine is developed, we need to manufacture enough for everyone around the world, because it's not going to be a perfect vaccine. It's going to be in our interest to minimize this disease everywhere around the world, so there are fewer carriers, less contagion, and less economic disruption everywhere in the world. So a go-it-alone approach doesn't maximize the scientific results, and a go-it-alone approach is not in our economic interest. With that, let's open it up to the next question. Don, do we have somebody?
We do. William, I don't know where you're calling from, but the question's about assistance to the states. William, you're on.
Hello, can you hear me?
Hello, Will. Yes.
Hi. Thank you for your diligent efforts, Brad Sherman. You've done a great job. Thank you. My question is, in the next round of funding that you try to get through Congress, could you please try to concentrate on getting assistance for the cities, and especially the CTE education programs that do so much? My son's in a program, where he could get a really good job coming right out of high school, and it's in danger of getting cut just because cuts are everywhere, and we really need to fund these kind of programs.
I don't know much about that particular program, but the broader part of your question, and it does sound like a very good program, the broader part of your question is to make sure that state and local governments can carry on their proposals. And this is education, which is critical. It's also the first responders and it's also our public hospitals. These folks are on the front lines. And the position of the Republicans has been, we'll give money to states in maybe a few big cities, but only a few. Only to the extent they have additional costs as a result of COVID-19. And there are those additional costs. But the biggest economic impact is not the additional costs that this is putting on states and localities, but the loss in revenue. People who aren't working are not paying state income tax, and people who are not shopping, I mean, my God, you go to Topanga and nobody's buying anything. You go to Fashion Square, it's closed. Without that sales tax, so what Democrats are fighting for is $500 billion for state and local government to replace the revenue they're losing, and to make sure that they are healthy and staffed in order to deal with the additional tasks of COVID-19.